Welcome to Kidney Disease Explained, and this is the workshop where you are going to want to watch it if you have kidney disease or if someone, like a loved one in your life, has it and you want to understand it more. The reason that I recorded this is because there's been some recent breakthroughs and advancements in the treatment of kidney disease that I have to share, and it honestly is giving hope to a lot of people who previously thought all they could do is really slow down the progression of their kidney disease. Well, now it may actually be able to be reversed. So I'm going to go through this research and really explain that step by step. So what you're going to learn is how the kidneys themselves work, the root cause of kidney disease and how it develops. And this is really important. And then we're going to go through the different stages of kidney disease, and I'm going to explain those one by one. So these can oftentimes be confusing. You have stage 1, stage 3, stage 5. What does that mean? Well, I'm going to go through all of that. Then we're going to talk about the available treatments for kidney disease, including the one that is actually helping people reverse stages of kidney disease and gain kidney function back. And then I'm going to talk about the steps to receive help if you are not pleased with your current kidney treatments. And just a little bit of information about our clinic. We've been featured in Forbes magazine and these other publications. So I just wanted to let you know we've been featured in these because of the results we get. This is actually our global network of 29 clinics in 21 countries. And the importance in this is we stay networked with other clinics around the world so we can bring the best of the best results. In fact, we have hundreds of reviews from people all around the world, and we have over 213,000 follows. So what is kidney disease? Chronic kidney disease is defined as the presence of kidney damage manifested by abnormal albumin excretion or decreased kidney function, quantified by GFR, that persists for more than 3 months. Here are some of the complications that are associated with chronic kidney disease. So this comes right from the NIH Public Access or National Institute of Health. This is a government organization as well. So I don't say this to scare you. I just want you to know there are complications to chronic kidney disease, and I want to go through a few of them. So if we scroll down here, we'll see that the first major complication associated with kidney disease is anemia. So anemia usually accompanies progressive chronic kidney disease, and the overall prevalence of CKD-associated anemia is approximately 50%. This means 50% of people with kidney disease have anemia. So why is this dangerous? Well, the anemia of CKD, you'll see here highlighted in yellow, increases morbidity and mortality from cardiovascular complications. So this means if you have heart problems, which we're going to go through here in a little bit, with kidney disease, anemia is going to turbocharge the damage that is done. So next, if we scroll down here, we'll see that there are mineral and bone disorders associated with kidney disease. So what does this mean? Well, right here it means that mineral bone disorders significantly increase mortality in CKD patients. In fact, hyperphosphatemia is one of the most important risk factors associated with cardiovascular disease in CKD patients. So anemia turbocharges the damage that heart disease causes. Well, these mineral disorders also turbocharge the fact that you could have a heart complication. So we'll see that all these systems really kind of work on each other in a negative way. So right here, the next complication is cardiovascular risk. So the increased cardiovascular risk associated with end-stage renal disease has been well established. So we see here that there is evidence that even mild to moderate degrees of renal impairment are associated with increased cardiovascular risk. So in the past, we really only thought, according to the literature, before we had this article, that heart complications were only a complication of end-stage renal disease. But now we're finding out that the heart really starts to get damaged even in the earlier stages. And also, I just have to say here, diabetes is associated with adverse outcomes in all stages of kidney disease. So if you have diabetes and kidney disease, they're really going to work together on your body to really, really negatively impact your health. So you'll have to address both of those things. And we help people with that literally every single week. So we are experts when it comes to addressing multiple conditions. But you can also see here that proteinuria is associated with an increased risk for cardiovascular disease. Well, this happens in every stage of kidney disease. So all these things are working together in your kidneys to either heal the body or to negatively impact and make your health worse. And also CKD patients are more likely to develop congestive heart failure. So I just want you to know that the complications of chronic kidney disease are very severe. 1/7 of adults over the age of 20 have chronic kidney disease. That's about 13% of the population. And anyone with heart disease or diabetes is inherently at risk. And that's because these diseases really affect the kidneys themselves. And this is alarming, is that the first stages of kidney disease often go undiagnosed. I'm going to teach you how to read your blood tests so you can know if you have kidney disease or what stage it is and what that means for your life. Also, it's considered incurable by many authorities, and this is just because they have not looked at the recent research and the scientific advancements that I'm going to go through. Because of this, though, typically sufferers are told is that all that can be done is slowing the progression of their kidney disease. And while that was true in the past, I have results to prove otherwise, and people are actually being able to now reverse their kidney disease. And instead of it getting worse, it's actually getting better. But you have to use the right tools that are backed by the right research and science. Now let's dig into the kidneys themselves, and they are the body's fine-tuned internal sensors that do a lot of important functions, and a lot of people don't know what these functions are. So the first one that most people do know is that they filter the blood and dispose of waste products in urine. So this is really important because it's how our body detoxifies along with a couple other organs, but the kidneys actually have a very large role in detoxification. So if you're sluggish or fatigued and you have kidney damage or disease, there's no wonder, because your body is more toxic than it should be because they're not functioning properly. The next thing they do is balance the fluid levels in the body. So they help you stay hydrated. You know, if you drink too much water, what happens? Well, usually you have to urinate a lot unless you have really bad kidney disease and you're unable to. If you're dehydrated, though, your kidneys cause the water that's in your body to get reabsorbed instead of filtered out when you pee. They also help regulate your vitamin, mineral, and hormone levels. So the next thing they do is monitor pH levels. Now, pH is really important because it's the amount of acid or base that is in the body and in the blood. And there's a very fine window. It's actually 7.35 to 7.45. Our blood has to maintain that pH or we will die. So the kidneys are really important in doing this. And the last thing they do is help maintain blood pressure. So you can see that the kidneys do a lot more than just helping you pee. So they're really important to your health, and they need to function properly, or you could have symptoms of all these other diseases when really your kidneys could just be at fault. I now want to go over kidney anatomy because I'm going to be going over some of these structures when I talk about kidney disease. So the first thing here we have is the renal artery. Now this is where blood flows in the kidneys to be filtered. Next is the renal vein. This is where the blood flows out of the kidneys after it's been filtered. And the structures that are in between the artery and the veins are the capillaries. What are capillaries? Well, really lock this word in because they are so important in the development of kidney disease. The capillaries are the body's tiniest blood vessels, and specifically in the kidney, this is where these functions that I just talked about actually take place. So they're really important. We're going to revisit these here in a second. Next are the ureters. This is where urine is taken to the bladder to be excreted. The next structure here is really, really neat. And this just shows you how important the kidneys are to the body. And this is the capsule. So this is a connective tissue layer that surrounds the kidneys that really protects it from damage. Diving deeper here is the cortex. Now, this is the very most outer layer of the functioning part of the kidney. Let's take a look at the medulla. That is the inner part of the functioning parts of the kidneys. Within these structures themselves are the pyramids. So these are subdivisions of the renal medulla, and there's about 10 to 18 of them in the adult kidney, but this is the structure where things really get important. So here is a cross section of the kidney. This is just the kidney cut in half. Inside it, though, is the renal pyramid. So remember when I talked about that inner structure that's really important? Well, this is why. It's because of the nephrons that it contains. Now, the nephrons are the functional units of the kidney, and it turns out that there's a tiny structure in there that is actually the root cause of kidney disease when this thing gets damaged, and that would be the glomerulus. So the glomerulus is the tiniest part of the kidney that contains the capillaries. So I wanted to show you this because it's really easy to see how the kidneys function. So the kidneys obviously filter these different things. They have all these functions, but where does it take place? Well, it takes place in something called the glomerulus, which you see right here. And all these little tiny things moving through there, they're moving through the capillaries or the tiny blood vessels. And this is where the kidney must function right to actually work. So it goes down through these, back up, things get excreted. This is the normal function. So when these functions do not happen properly, then we get renal failure. What causes kidney disease? Well, like I just mentioned in a few slides before, when the capillaries in the glomerulus are damaged, fibrosis occurs. Fibrosis means scar tissue. So when you have poor health or use different drugs, even prescription medications, even too many supplements, or you have things like diabetes or heart disease, these can all cause damage to the capillaries in the glomerulus, and this is the root cause of chronic kidney disease. Here's an article right from the World Journal of Nephrology, a very renowned journal in the kidney publication world, and it's about stopping chronic kidney disease progression. So I just want to show you here the root cause of kidney disease, and we're going to scroll on down here to the third page, and it says right here, glomerular sclerosis is the key feature of CKD progression, or of chronic kidney disease progression. The tubulointerstitial damage correlates better with the progression than glomerular damage as well. So basically it says the inflammation in the internal tubules and the tiny vessels of the kidney and the glomerulus are responsible for the progression of kidney disease, because what you see here is that as this fibrosis occurs, proteinuria, which is protein in the urine, is the link between glomerular and renal tubule injury. So this research says that the injury to the glomerulus and the other tiny tubules associated with it are responsible for progression of kidney disease. So in the normal glomerulus, and you can see this here on the left, this is a healthy glomerulus. So urine actually flows into the ureters from the glomerulus after the blood is filtered in the capillaries. But in the unhealthy glomerulus, you're going to see all these little yellow dots here, and I'm going to explain that here in a second. But instead of the blood filtering in through the capillaries, going in smoothly and going out, well, we have a problem. So here you can see the constricted efferent arteriole. Well, this is the exit arteriole, and constricted means it is too small. So if you've ever used a garden hose before, maybe you played in the sprinklers or something as a kid, I always remember as a kid, what would happen if you put a kink in the hose? Either nothing's going to come through the end of the hose if you kink it strong enough, or what's going to happen is water is still going to get through the hose, but it's going to be very high pressure because the opening of the hose isn't big enough, or if you step on a hose. So this is what's happening to the arteriole where the blood is supposed to flow out of. Not enough blood is filtering out in time. At the same time, there's a dilated afferent arteriole. So what does dilated mean? Dilated means too big. So the capillaries that are taking the blood into the glomerulus are too large. So this would be like a fire hose, okay? So what is going to happen if you connect a fire hose with all this water flow, too much blood getting in, to a small garden hose, and it's kinked? Well, there's going to be too much pressure because there's way too much blood coming in and not enough blood getting out. And what happens over time if there's too much pressure in a hose? It's going to burst and it's going to leak, right? Well, this is the exact same thing that happens in the capillaries and the glomerulus. And when this bursts and leaks, proteins actually slip out and sneak out of these capillaries. And this is what we use to diagnose kidney disease, the presence of proteins in the urine. And that's what makes it really simple to diagnose. So we know that the capillaries aren't working right, so the filtration processes of the kidneys aren't working right. That's what causes kidney disease. In the normal glomerulus here, the capillaries keep the proteins in the blood. In the unhealthy glomerulus, when the capillaries are damaged, proteins slip out, and this is how we diagnose kidney disease. I just gotta say, there are a lot of tests to test kidney function, but really there's one test that stands out according to medlineplus.gov, and that is eGFR. By the way, that is a government-ran health website that is an authority on health, and they say that eGFR is the most important test to test for kidney function. So what is estimated glomerular filtration rate? The estimated glomerular filtration rate, or eGFR, is a test that tests how well the kidneys are functioning. So remember those glomerulus that we just went over, right? The ones with the healthy capillaries in a person without kidney disease, and then the ones in a person with kidney disease and how the capillaries are spilling proteins into the blood. Remember I talked about the garden hoses, right? And fire hoses. Is the blood coming in at the same rate it's going out? If not, we're going to have a problem. Well, eGFR, or estimated glomerular filtration rate, is the specific blood test you need to understand to see if you have kidney disease and to see which stage it is, because this tests how well are these glomerulus working. So let's go into these stages one by one here. Here is an overview of the different stages of kidney disease. There are 5 of them, and they're characterized by different GFRs, that test we just went over. I want you to know where I got this information from, and it comes from the CDC, which is a government website. So right down here, the stages of kidney disease are clearly defined, and you can see here from stage 1 to stage 5, they're associated with proteinuria, protein in the urine, and different GFRs. So I want you to know I'm not making these numbers up. They come right from the government. So let's continue to go through these. Stage 1 kidney disease is very interesting because this person has a normal GFR, but they have proteins in the urine. So if you have a normal GFR, which is greater than 90, but you have proteins in the urine for more than 3 months, you have stage 1 kidney disease. And this is the very beginning stage of kidney disease, but don't think that it's not dangerous, because the life expectancy of someone with stage 1 kidney disease, and I'm going to show you how to see exactly what your life expectancy is if you have kidney disease here in a second, but for a 55-year-old male, it's only 18.6 years. And for a 70-year-old male, it's only 9 years. So just because it's stage 1, typically people think, oh, well, it doesn't really matter. Well, it does matter. And here's what's more scary is that 0.5% of people with stage 1 kidney disease progress to advanced stages each year. Stage 2 kidney disease is quite similar to stage 1, except the GFR is decreased. But there are actually 2 times the amount of people in America with stage 2 kidney disease than stage 1 kidney disease. Life expectancy is the same as stage 1. 18.6 years for a 55-year-old male and only 9 years for a 70-year-old male. And just like stage 1, 0.5% of these people progress to advanced stages each year. This is the tipping point of kidney disease, however. So stage 3, warning, tipping point. Now, what do I mean by tipping point? Well, let's go into stage 3, and I'm going to show you exactly what that means. And because it's the tipping point, it's divided into stage 3A and stage 3B. So the GFR of stage 3A kidney disease is anywhere between 45 and 59. 4 times the amount of Americans have stage 3 than stage 1. The life expectancy, now really pay attention to this, for a 55-year-old male with stage 3A, again, GFR between 45 and 59, is 16 years and 8.4 years for a 70-year-old male. 1.5% of these people with stage 3 kidney disease progress to end-stage renal disease every single year. Now, why did I call it a tipping point? Well, it's because of stage 3B. So let's go ahead and take a look at that next. Stage 3B, warning, see these little signals here? This is where things get really, really bad. And it is because people have half the life expectancy of people with stage 3A, which is 8.7 years for a 55-year-old male. Now remember, people with stage 3A, 55-year-old male, had 16 years. Well, now it's down to 8.7 and 5.9 years for a 70-year-old male. And actually, this is the stage of people that we really help the most, because they see this workshop, they say, I've got to get on top of this right now. This is not something you want to wait on. If you can do something to help reverse it, look at the life expectancy. take it from that. If you want to live, you want to be healthier, really, this is the thing, the sooner the better. Stage 4 kidney disease. Now, this is the second to last stage. And by the time this time, most people know they have kidney disease because they have some pretty significant symptoms and they're typically very sick. So people with stage 4 kidney disease have a GFR between 15 and 29. Now, this is very reduced. So this is the stage when patients traditionally must start preparing for dialysis or transplant. Why do I say traditionally? Well, that was because this is the only option people had before this breakthrough in science. But I just want you to know it's a very important stage because this is when you have really, really rapidly declining kidney function. And the life expectancy for these people is only 6.6 years for a 55-year-old male or 3.9 years for a 7-year-old male. And 1.5% of people with stage 4 kidney disease progress to end-stage renal disease every single year. Now let's take a look at that and see what that means for your health. Stage 5 kidney disease or end-stage renal disease. This is the worst stage, and this is why. End-stage renal disease, this means this is the last stage. So this is when dialysis or transplant is required for someone to live because the kidneys can no longer function properly on their own. And this is a GFR that is less than 15. So the life expectancy of people with this is 6.5 years for a 55-year-old male and only 3.8 years for a 7-year-old male. Now, this is about the same as stage 4, but this is on dialysis. So I'm going to talk about dialysis and what that does to your body and what that looks like. But next, I really want you to understand the life expectancies for your specific stage and age. So really lock this in and let's go to the research to see what that is. I got these life expectancies for the stages of kidney disease from another research paper. And by the way, this research that we use in our clinics to determine how we do our care and where these facts are coming from are peer-reviewed literature. That means other scientists and doctors all around the world looked at this research and said, yes, this is valid. Yes, this is accurate. So you'll see here life expectancy with chronic kidney disease, an educational review. This means this author looked at tons of research and came together and found out what the actual values were. So we can see male, female, the ages, the GFRs, and then you can go. So if you're a 35-year-old age male and you have a GFR of 32, you're going to go over here, GFR 30 to 44, you're 35, so it's going to be 16.3. So I encourage you to pause this video real quick and go ahead and match up your age with your GFR and see what your life expectancy is so you know what you're dealing with here. But there's hope because it doesn't have to be like this because your GFR can actually be increased, which your doctors probably don't tell you, but I'm going to share with you those tips here in a little bit. So I went ahead and broke down this chart because I want it to be really easy for you to see what your life expectancy is if you have kidney disease or a loved one in your life. So this is how you read the chart. You're going to see several boxes here. Now the first one is for people who have stage 1 and 2 kidney disease. Next, this is for people with stage 3A kidney disease. Then we have stage 3B kidney disease, and then we have stage 4 kidney disease. Now, if you have end-stage renal disease, that looks a little different depending on whether if you're getting dialysis or if you have had a transplant. But at that stage, it is really crucial to get help as soon as possible. But this is for people who have anywhere up to stage 4 kidney disease. Here's an example of how to read the chart. So if you're a male and you have stage 3B kidney disease, you're going to go to this column right here. Then you look at your age. So for example, if you're 55 and you have stage 3B kidney disease, you're going to look right here and then you look at the number that is highlighted. So in this case, for a 55-year-old male with stage 3B kidney disease, he can expect to live 8.7 years. And again, this is peer-reviewed literature. That means this author looked through a bunch of studies that are valid, backed by science, and these are where these numbers come from. End-stage renal disease, typically by the standard medical care, only has 2 treatments. That is dialysis or transplant. The place that I got the standard of care or the standard medical procedures for treating kidney disease came right from this government website, the NIH. So
what happens if my kidneys fail? Well, to replace your lost kidney function, you may have a few options, which include hemodialysis, peritoneal dialysis, and kidney transplant. So let's go back and explain each one of those.
A few quick facts on dialysis. Over 380,000 Americans are on dialysis. And there are two types of dialysis, peritoneal and hemodialysis. Let me go through each of these so you understand how they work. Peritoneal dialysis. This is where a catheter is medically inserted into the peritoneal cavity in the body. Now, when the kidneys don't work right and proteins and different things sneak out of those capillaries, right? Well, fluid accumulates in the body because the kidneys can't filter it out. So this catheter is a tube that's surgically implanted into this cavity, and then it's connected to a diacylate bag. Now, a diacylate is a solution that helps bind the toxins inside this cavity. So you can see here, after it is bound, now we're highlighted in purple here, the diacylate with the waste products is drained from the peritoneal cavity, and it binds the toxins and then pulls them out in a substance that could be compared to urine. Now, the other option of dialysis, which is the most common type, is hemodialysis. Hemodialysis is the type where your bloodstream or blood flow is actually hooked up to a machine, and this is the most common type that people are familiar with. So this is where the blood from the body is going to be filtered through a solution called diacylate. So right there's a fistula that's implanted into the patient. The blood goes out, it goes down through here, just like it would normally go through the capillaries. It gets filtered, and then it goes back to the patient. Again, this is the most common type of dialysis, and 90% of dialysis patients use hemodialysis. It requires typically 3 sessions a week that last 3 to 5 hours each. Here's a picture of someone getting hemodialysis, and the reason I put this here is because I used to work in a hospital and transport patients to and from dialysis. And I always remember one thing is they're always excited to get out of dialysis, but going to dialysis, not too thrilled. And it's because they literally just sat there and they told me, man, this is the most boring thing that I do all week. I just have to sit there because my kidneys aren't functioning right. Well, this is the grim reality of receiving dialysis. And remember, the life expectancy when you get dialysis is still really poor. Price alert, it costs $89,000 a year. So insurance definitely typically covers part of this. But again, the way insurance works is there are copayments and there are premiums. So if you have to be on dialysis, you're going to really be looking at a large financial investment just to help you live a few more years. Because the 5-year survival rate of people on dialysis is only 35%. That means if you and 2 of your friends all go to dialysis in 5 years, 2 of you are not going to be there. The other option for people with end-stage renal disease is a kidney transplant. So I want to show you a website that contains some facts about transplants because I really couldn't sum it up better myself.
To really go through kidney transplantation, I was looking at this site doing research that comes from the University of California, and I just couldn't put these statistics in better words. So here's the statistics for kidney transplantation. And a lot of people know that one of the issues with a kidney transplantation is you get a kidney that's not your own. So for life, you'll have to be on immunosuppressants, which actually suppress the immune system and are going to leave you more susceptible to infections. So a lot of people who get a transplantation, at least they live longer, but they're often very, very sick because their immune system doesn't work right. But right here, we have transplantation. So the 5-year survival rate for transplant recipients, I'll go ahead and highlight this here, is 80%. But there is an acute shortage of donor organs for end-stage renal disease patients. There are more than 100,000 patients on the transplant wait list, but in 2016, only about 20,000 people received a transplant. So this is a problem because even if you say, I do want to get a transplant, there's only 20% of the people that are on the list get it each year. And the issue is that once you have end-stage renal disease, the life expectancy of your life, even on dialysis, is about 5 years or less typically. So you could be waiting around for an organ that is never going to get to you before, unfortunately, you pass away. And I hate to be grim, but I just want to let you know these are the true statistics.
So you can see that these standard treatments are really limited, but this is where the hope is restored in many people who discover this. And if you're one of the ones watching this, you're fortunate enough to have discovered this research and information that is changing the course of kidney disease. And this is stem cell therapy. A stem cell, and this is taken right from Webster's dictionary, is an unspecialized cell that gives rise to differentiated cells. So basically it means it's a basic building block that can turn into different cells. And it's the starting material for all tissues. They're found at all stages of development. They can continuously reproduce themselves while maintaining the ability to differentiate. That means they can reproduce into different types of cells depending on what type of cell the body needs. And many of them are located on the capillaries in the body. Before I go any further though, I want you to understand there's two primary types of adult stem cells that we are concerned with when it comes to healing. And the first type are mesenchymal stem cells. Now these are the types that really are the body's natural pharmacies that can secrete natural medications that your body produces to heal the body. And the next type here is the hematopoietic stem cell. And this is the type that is really, really good at regrowing and repairing blood vessels in the body, specifically the capillaries. And this is done through a process called angiogenesis. That means angio, blood vessel, genesis, creation. So the creation of new blood vessels. Now that we understand those types, I want to take a look at some more research to show you why this is so important.
And that comes right from Scientific Reports, which is another peer-reviewed journal. And it says right here, chronic kidney failure, mineral bone disorders, leads to permanent loss of hematopoietic stem cells through dysfunction of the stem cell niche. So remember when I talked about one of the complications of chronic kidney disease is this mineral bone disorder. Well, this actually says it leads to a decrease of HSCs or hematopoietic stem cells. So we'll see that these stem cells I'm talking about that are able to regrow capillaries lose their function and they actually get destroyed in chronic kidney disease. So if the stem cells that are there are supposed to recreate new capillaries and they don't, what's going to happen? Well, the capillaries are going to get damaged and the glomerulus is not going to work properly. So if we look to the bottom of the screen here, right down here, you'll see we demonstrate that chronic renal failure leads to a significant decrease in hematopoietic stem cell repopulating capacity as a result of functional defect in the HSC niche. Let me put this together in simple terms for you. Chronic kidney disease leads to a decrease in hematopoietic stem cells, so they're not able to heal the glomerulus and kidney disease gets worse. So what do we have to do? Well, if there's a lack of hematopoietic stem cells, what is going to happen if we put hematopoietic stem cells back into the kidney? There's no longer going to be a lack of them, and they're going to restore their natural function, which is to heal the kidney and create new blood vessels, which is imperative to healing kidney function. So let's go back to these other slides and see what this does further.
We can see from that research article that it's really important to have the right types of stem cells in the body if organs are going to heal properly, specifically the kidneys. So how to increase kidney function? Well, the first step is to restore the damaged kidney tissue. This is where the MSC or that mesenchymal stem cell comes in place, the kind with the natural pharmacies. And the best source of mesenchymal stem cells is the adipose tissue. Step 2, after repairing kidney damage, is repairing and regrowing the capillaries. This is going to increase the GFR. So remember the GFR, the number is directly associated to how advanced kidney disease is. Well, if we can regrow, repair the capillaries, GFR should go up because the better the capillaries work. Remember the fire hose and the garden hose? Well, we want to balance those hoses out. And the best way to do this is through hematopoietic stem cells. So the best source of these come from bone marrow. So really, when you combine both of these, research shows that it works really well, and it's part of our process and why we look at the research, because we want to know what's going to work best for people. That's why we use both types of stem cells.
I wanted to show you where we get our clinical evidence from peer-reviewed literature of why we do our procedures the way we do them, combining both of these types, a mesenchymal stem cell from adipose tissue and a hematopoietic stem cell from bone marrow tissue. And by the way, barely any other clinics in the world who help people with kidney disease and stem cell therapy combine these two at the same time. So we really try to look at the research and see what works best. So this was a review of clinical evidence for mesenchymal cell-based therapy, and I just want you to see here in the blue box. CKD is characterized by reduced renal regenerative capacity. This means that the renal function is impaired because they cannot regenerate. Well, that makes sense. If an organ is being damaged and it cannot regenerate or heal, what's going to happen? It's not going to work right. However, administration of both bone marrow MSCs and adipose tissue MSCs have demonstrated significant renoprotective effects, including reduction of intrarenal inflammatory infiltrate, decreased fibrosis, and glomerular sclerosis. So, remember when I talked about the fibrosis or scar tissue building up in the kidney, and that's what leads to the damage to the glomerulus or glomerular problems? Well, this is saying right here that these both stem cells combined together can work efficiently in helping protect the kidney not only from further damage, but can actually help heal the scarring and fibrosis that has occurred and restore normal function.
Review. The glomerulus is the functional unit of the kidney because of the capillaries it contains. And remember from earlier, when the glomerulus gets damaged, fibrosis occurs, and that is how kidney disease progresses. So, what would you do if you were trying to reverse kidney disease? Well, one, you'd probably want to stop the damage to the glomerulus. That's what the standard medical community says. Stop the damage or try to do this. But they don't really give you many ways to do this. We have a whole process that we use at National Stem Cell Institute that involves diet, lifestyle, all these different things to really use the best tools available, because we want to do every single thing we can for patients. But the other thing you're going to have to do is not only stop the damage, but if you can reverse the damage by repairing the capillaries, when you want to do that? Well, exactly. That's where we focus our efforts. This is a picture of the capillary itself. These contain the body's natural pharmacies, which are mesenchymal stem cells. So this is how the natural pharmacies of the body work. So in the body, there are obviously capillaries, and these are all over the body, but we're really focused on the capillaries in the kidney. So on the capillaries, there lives something called a pericyte. Really pay attention to this. So peri means around, cyte means cell. Well, as you can see here on the bottom left, these pericytes actually live on the capillaries. So this pericyte is surrounding the capillary, okay? And when an injury or inflammation occurs, and in chronic kidney disease, you have both of these things occurring. Remember that fibrosis and scarring that happens to the capillaries? Well, when this occurs, these pericytes should turn into mesenchymal stem cells, or the natural pharmacies of the body. But if there is a shortage of them, or if the kidneys have been damaged over time and all the pericytes are damaged and they're not working right, nothing's going to happen in this area, right? Things are going to get worse because the natural pharmacies don't work. Well, this is what happens in chronic kidney disease.
Here's a research article explaining how mesenchymal stem cells are pericytes. And this comes from Arnold Kaplan, who is actually the founder, the guy who discovered mesenchymal stem cells in the body himself. And he says that they are an injury drugstore. So basically, he says when injuries occur in the body, that these natural pharmacies on the mesenchymal stem cells go to work healing the body. But the main point is here, down in yellow, I wanted you to see these and other observations allowed us to speculate in a commentary in this journal that all mesenchymal stem cells are pericytes. So you won't hear many other people talking about pericytes. It's because this information is newer and people don't even understand this yet. So we really stay on top of the research so that we can understand how to heal the body in the best way possible.
So you have injury or inflammation that happens to the kidney tissue itself. Remember when I said, what do you have to do to increase kidney function? Well, you have to repair the kidney tissue, and then you have to help the capillaries regrow. Well, so here we go. Injury or inflammation to the kidney tissue activates pericytes into mesenchymal stem cells. And that's what really helps heal the tissue. And you can see here below, here's a little diagram of injured tissue, and these pericytes are rushing to the damage. They turn into stem cells, and this is the healing response of the body. And stem cells, specifically mesenchymal stem cells, help regenerate that tissue. This is the same thing that happens if you fall and you get a cut on your arm, right? Well, you bleed. That stimulates the capillaries in that area to release the pericytes into mesenchymal stem cells. Then those actually help repair the cut. So first, blood clots, obviously, but then new tissue forms. So this is what mesenchymal stem cells also should do in the kidneys if the kidneys are healing. Now, if they aren't, because there's not enough of these pericytes and mesenchymal stem cells, what should you do? Well, you should replace them. That's the whole point of stem cell therapy. Then they can resume the normal healing function. So now we see how kidney tissue itself can be repaired and regenerated. Now let's take a look at the capillaries. So when there is capillary damage or destruction, so this is the same picture of that capillary that I talked about earlier when proteins are leaking out of it. Well, this causes hematopoietic stem cells to regrow the capillaries. So remember, there's main two types of stem cells. The mesenchymal stem cells are the body's natural pharmacy, and the hematopoietic stem cells help regrow blood vessels. Now, I must say there is some crossover with this, but these are the primary functions of these stem cells. So if you're a super science person and you look it up and you say, well, mesenchymal stem cells can help regrow blood vessels too. That's true. I'm just talking about the primary function. So new capillaries replace the leaky ones in the glomerulus, the ones that are defaulting, and this increases GFR. I want to clear this up real quick, and this comes actually from another workshop called NSI Stem Cell Summit, and you can look that up on vimeo.com, NSI Stem Cell Summit, just like the title on the top right. But I want to talk about two different types of stem cells, rather two different classifications. There's adult stem cells and embryonic stem cells. So adult stem cells come from adult tissues. These are actually even endorsed by large organizations like the Catholic Church and the Vatican. They've been studied since the 1950s. They can only form certain cell types, and you'll see why this is important when I compare them to the embryonic. But using these in stem cell therapy is safer than taking an aspirin a day. Embryonic stem cells, on the other hand, come from aborted fetuses, so this is why they're very controversial. And President Bush banned these in 2001. And other than being controversial, they can actually even form cancerous cells. So adult stem cells can only form certain cell types, and those are healthy cells that need replaced because they're damaged in the organs that they target themselves to. So in addition, embryonic stem cells are unstable and unsafe. So at NSI, we only use adult stem cells. We never use embryonic stem cells. I just have to point that out. So let's break adult stem cells down. There are two primary sources of adult stem cells. Ones that are from your own body, which are called autologous adult stem cells, or ones that are taken from a donor. And these are not from you. These are called allogeneic stem cells. So of autologous stem cells, when they're taken from you, there's no chance your body's going to reject them because they're your own cells. So on the other hand, the allogeneic stem cells, which come from umbilical cord tissue, which is called Wharton's jelly or umbilical cord blood. The umbilical part kind of throws some people off. These are not taken from embryos. These are taken from a mother's umbilical cord after she gives birth. But because they're not from you, if these types of stem cells are used, there is a small chance your body will reject them. In addition to that, you'd really be lucky to get any living stem cells at all from tissues that are not taken from you. And that is just because of the way they're processed. So to recap here, adipose tissue has the most mesenchymal stem cells per dose of all stem cells available in the United States. Bone marrow has the most hematopoietic stem cells per dose of stem cells available in the United States. Wharton's jelly has a very low amount of mesenchymal stem cells because of the way it's processed. Most of them die in the processing. And cord blood has few, if any, mesenchymal stem cells. So if you want the best chances of regenerating kidney function, what are you going to do? Well, if it was me, I would pick the best sources of stem cells. So research tells us that the best sources for mesenchymal stem cells, or the natural pharmacies, is from your own fat tissue. It also tells us the best source of hematopoietic stem cells to help regrow and regenerate those capillaries comes from your bone marrow. So this is an in-depth view of how stem cells heal the body. First of all, they modulate the immune system. So this is so important because when the immune system is ramped up too high, like in chronic inflammation, when kidney disease happens too long, the body's just not going to heal the way it should. So stem cells actually go in, down-regulate pro-inflammatory pathways, and up-regulate anti-inflammatory pathways. So this is also why they're so good at helping people reverse autoimmune disease. And in fact, there's another workshop that I put together on that called Autoimmune Healing Secrets. You can search for that on Vimeo.com if you or anybody you know has autoimmune disease and wants to know everything you can possibly do that's backed by research to help reverse autoimmune disease. But this also helps people with kidney disease because it helps the immune system go into a state of healing the body instead of making the damage worse. Stem cells also have regenerative properties. This means that they can help repair and regenerate different cells and different tissues. So you can see here, this is a mesenchymal stem cell, and it has the ability to turn into all these different types of cells, but we're really concerned with kidney for this workshop. But I just want you to know whether it's liver, muscle, lung, cartilage, like in joints, heart conditions, gut problems like leaky gut, nerves. A lot of people don't realize nerves can be regrown, but stem cells can help repair nerves now. But I just want you to know they can actually differentiate or turn into different cells and replace the cells that need to be replaced. Speaking of regenerative properties, mesenchymal stem cells are so great at helping regenerate the kidney. And this comes right from a research article from the Nephrology Journal. And it says, mesenchymal stem cells are a rescue approach for recovery of deteriorating kidney function. That is literally the title. And there's just one line you need to see right here. And it's right down here. That the stem cells therapeutic modality, this is in the bottom of this box, allows self-renewal and intervention in building and maintaining the structural and functional integrity of tissues. So basically, stem cells help rebuild tissues. And because of this, that's why they're so great at helping reverse chronic kidney disease. Remember when I said mesenchymal stem cells are like these natural little pharmacies and they secrete different natural medications that the body produces? Well, one of them that they do is VEGF. Now, what does VEGF do? Well, when VEGF binds to an epithelial cell, which is a type of cell in the body, or an epithelial progenitor cell, so this is what EC and EPC means here, it actually stimulates angiogenesis. So angiogenesis, as I described before, is the creation of new blood vessels. Now, hematopoietic stem cells, the ones we went over that really help stimulate angiogenesis before, are the masters of this, but mesenchymal stem cells can do this too. So you're really getting it from two types of stem cells. We know that repairing the capillaries is imperative to helping restore kidney function. This is a research article showing how stem cells can help promote angiogenesis and regrow new blood vessels. So multipotent mesenchymal stromal cell therapy, or it stands for mesenchymal stem cells, same thing, and renal disease and kidney transplantation. But we're going to go down here and we're going to see that
In recent years, it has become clear that not only fibrotic repair, remember the fibrosis in the glomerulus that causes kidney disease, is possible, but also restoration of damaged kidney tissue can occur. So this is explaining how this occurs. And one of the big ways, as I was just explaining, is that angiogenesis is one of the key factors that allow stem cells to help the body heal. So you'll see right here, a large body of evidence indicates that MSCs could stabilize blood vessel formation and enhance angiogenesis in different injury models. Angiogenesis is a complex process controlled by a delicate balance of proangiogenic and anti-angiogenic factors. So basically, right here you have this pathway. VEGF binding to EC is promoting angiogenesis. So let's go back to these diagrams here, but I just want you to know I'm not making this stuff up. It comes from peer-reviewed literature and research that comes from all around the world.
And the last way mesenchymal stem cells help heal the body is that they can revert back to pericytes. So remember how a pericyte is so important, because that's the body's inactive form of a mesenchymal stem cell that just kind of hangs out on capillaries in the body. So it fortifies your tissue for future healing.
This fact comes again from this paper titled The MSC and Injury Drug Store by Arnold Kaplan, the founder of stem cells, or the founder of mesenchymal stem cells. And if we go down here, further on down, we'll see that they involve, what he's talking about is how MSCs work in the body, of MSC-mediated angiogenesis, and by MSCs stabilizing new vessels by returning to their earlier pericyte phenotype. So what he's saying is that the MSCs can return to the pericyte in order to future-proof the body's tissues against damage, which is awesome because future damage is going to occur, of course. It happens in someone every single day, even healthy people. But when you get these pericytes and they can turn into stem cells, then the damage is going to be reduced and the body can heal itself naturally.
Okay, this is probably what you've been waiting for. He said, this all makes sense, but does it actually work? Well, it does really well, in fact. And I must preface by saying this works differently for every single person. It depends on your unique situation, what you've done to this point, what stage you're in, what your expectations are, and what you're willing to do. If you're willing to do all the steps that we put together in a proprietary process, you're going to have the best results. But this patient, I just want to show you right here, they went from a GFR of 68, you can see it highlighted right here, to 79. And this happened in less than 4 months. So they were about to be stage 3, okay? They were borderline stage 3 with a GFR of 68. Now remember, stage 3 is the tipping point. So they said, I want to do this. I want to get right on top of it, did everything they could. And in 4 months, they're almost stage 1 kidney disease. So you can see that their kidney disease is being reversed. Here's a really exciting case, and this is probably actually my favorite. And this is a person that had stage 5 kidney disease, okay? So they came to us and their GFR, you can see here, is 10. So that's end-stage renal disease. Now, typically, again, this is the point of kidney disease where most doctors say there's nothing that can be done. You can either get dialysis or transplant. Well, I'm here to tell you there's this new option, and this person discovered this with us. And again, they did all the steps they could, including different foods and things to help repair their kidney function. And in 3 months, their kidney disease was reversed to stage 4. You can see a GFR of 15. So stage 5 kidney disease or end-stage renal disease reversed to stage 4 because they took the right steps, they used the right tools, and they followed the process step by step. And here is a case of a husband and wife that both had kidney disease, okay? So a different kind of kidney disease. The wife had chronic kidney disease, the husband had polycystic kidney disease. But at any rate, both of them were not able to urinate because their kidney function was so low. So they traveled to us from the Bahamas. And mind you guys, this is only 1 dose. Most people that have kidney disease this advanced are going to need multiple doses because you need as much healing cells as you can get in your body. But this is the awesome part, is that their GFR The husband's went from 4 to 5 and the wife's went from 4 to 6. Now that doesn't sound like that much, okay? But right here, it's highlighted, they were both able to urinate for the first time in years, and their energy levels are much higher. So when you're really thinking about what you want your future to look like, this is one option. Having a nurse hook you up to a machine just so that you can detoxify properly, or you can really look into the cutting edge therapy that's now available. So the question you gotta ask is, why would you want to go through this when you could have all of this? So those are really your treatment options. Of course, you got transplant as well, but that has its inherent risks. And like I showed you on that website, about 25% of the people who want a transplant can't even get it. So a lot of people are waiting around and they're dying, unfortunately. This is life expectancy. Now, you have two options. You can either take the steps to try to increase your GFR and possibly reverse your kidney disease, or you can do nothing as GFR decreases and kidney disease advances to end-stage renal disease.
I wanted to show you our YouTube channel, and I'm just going to pull up this testimonial that I just talked about, but it's NSI stem cell, and I encourage you to actually search for it if you want to watch more videos and testimonials and different doctors explaining just the different conditions that stem cells can help with if you're one of those people who's just very interested overall. But we're going to go down here and actually search for one of my favorite testimonials, and that's going to come from a patient by the name of Peter.
My name is Peter Malgady. I went to my doctor about 7 months ago, and he told me that my kidneys were in bad shape, stage 4 kidney disease, and I'm also diabetic. So I looked at some stem cell therapies. I checked out some other stem cell people, and I came to a seminar at SMI and decided this was the most promising and what I consider to be the stem cell therapy that would help me the most. My first treatment was about 6 months ago. Only 2 weeks after that first treatment, I was off all my diabetes medication. I no longer needed it, and my kidneys were improving. 3 months ago, I had a second stem cell treatment, and my kidneys improved some more. And just last month, I went to my kidney doctor, and my kidney doctor said he had never seen an improvement like this. He always felt that kidneys stayed as bad as they got. You could only stop them from not progressing to become worse. He had not seen a kidney improvement like mine. I'm almost in the normal range.
Choice is yours. The information's in your hands. The science is there. You've seen exactly how kidney disease develops and exactly what you need to do to help the kidneys repair and restore the natural GFR. So this is all you got to do. You just call the number at the bottom of the screen to the kidney hotline. They're going to connect you to someone who's going to review your case. It costs you nothing, but at least see if you can get help if that's what you want. All right, guys, thank you so much. Please share this with anybody that has kidney disease that you know, because we're on a mission to really reinvent healthcare and show people what true healing looks like.